So what we did in this study was conduct this study among about 14 million patients in the United Kingdom and ask the question of what oral antibiotics are associated with an increased risk of kidney stones. And what we found were 5 classes of oral antibiotics, all of which are very commonly prescribed, were associated with an increased risk. Those antibiotics were sulfa drugs, which include something like Bactrim, fluoroquinolones, like Cipro, broad-spectrum penicillins, which is Augmentin, nitrofurantoin, and cephalosporins, something like Keflex. So all of those drugs were associated with an increased risk of stones, but we found that the risk varied depending on what age you were exposed. So one of the important findings was the younger the age at exposure, so the younger the patient was, the greater the risk of stones. The second finding was the risk was highest within 3 to 6 months after the antibiotic exposure, but that risk continued and was sustained for up to 5 years after the antibiotic was given. That risk decreased, but it remained elevated for 3 to 5 years afterwards.